You asked about what is discouraging. What I really discourages me quite a bit sometimes is, I talk about the can-do attitude. Is this feeling of if we can't do it, we'll just go beg for, developed country, and we get all worked up and say they need to share with us, and
Yes.
and so on and so forth. Yes, that sharing will happen only after we've taken care of ourselves. I mean, that charity begins at home.
Yes.
That's just the way it is. With what is happening in India. And the funny thing is that even India also was moving some manufacturing to China. I do have a friend who, he has companies in India, and he invested in companies in China as well.
Yes.
So it's that whole thing of it's a global playing field. You can get anything you want anywhere. I think COVID has come to let everybody know that, yeah, that may be true, but you still need to have certain things at home.
Absolutely. Now, that's a case well made, I think, by the COVID pandemic, and hopefully people will not just fall back into the same patterns once the pandemic is out of our sight. We just fall back into the usual patterns because, like you say, it will not change. I mean, this is a pattern that has repeated itself again and again, and I think if African countries don't plan, look ahead, and actually take active measures to get this done, it will just continue like this, and they will continue to complain, and the pattern goes on.
And so many countries have been reliant on aid. For example, with HIV/AIDS.
Yes.
And before I left my fellowship, one of the things that we were talking about at the time, and Debbie Burks was in charge of PEPFAR at that time, was the number of countries that are about to get to that 90. And so when we pull out, what happens?
Yes.
What happens? That self-sufficiency needs to be there. After spending decades fighting HIV, if you pull out and then the country doesn't have the means of carrying on those programs, then we're back to square one. So those are things that the governments need to think about. Sustainability. How do we, and this all plays into it, the sustainable source of pharmaceuticals to take care of your people, of vaccines to ensure that your kids live to be the next generation. Because without those basic vaccines, look at what happens. The kids are just going to die. So
Yes.
we need to look at sustainability, and in order to do that, you have to look at health security. And health security is not just the hospitals, but it is your basic pharmaceuticals, essential medicines, and so on. And not running off to go to a hospital in the UK and hospital in Germany. I mean, I just hope that the pandemic has stopped all of that, and that it will not continue now that it seems like things are opening up.
Well, as African citizens, we are hoping that they will not be allowed in. They get kicked right back and go to the same clinics that we are going to as well.
At the end of the day, it's money though. So if somebody shows up in the hospital, I mean, that's the bottom line.
Yeah.
It's all financial. It's
Yes.
all financial at the end of the day.
That is true.